much for joining. This has been a really challenging year for everyone in and around the USAID and international development community. I wanted to start off by saying, this is a really amazing opportunity to get some feedback from the sector and to try and get some lessons learned out of the past many decades of WASH investments that the US has made and try to put them towards something in the future. I know it's been it's been a challenging year, and it's been hard to make sense of it, so I'm hoping that this will be not only a productive session where we're able to carry forward some insights, but also one where we get maybe a little bit of catharsis out of it. Not a full group therapy session, but maybe just a little bit of that. I also want to say something that I do to cope with difficult things is use humor, so I am not making light of the situation at all. All of us who have organized this session have lost our jobs. We know probably many people in the room have lost their jobs and funding, and it's just a really hard situation all around. So we're just doing our best to try and move forward and see if we can keep some institutional memory and knowledge. So to get started, let me make sure I'm here. So we're going to introduce you to something called Woo Clap. So if everyone, including online, could scan this QR code, we're going to start with a very quick, just icebreaker exercise, kind of get to know what everyone's doing in the room and online. So I'm going to give you a minute, and we're going to use this a few times throughout this this side session and throughout the week at all of the USAID side sessions. So I wanted to let's work out the kinks first. Does it say join session or something?
You have to advance for there to be a thing. Yep.
Okay. Okay. So when I advance the slides, it will advance on your phone. It's tricky, but it's actually really cool. We're very excited about it. So just to kind of get started and to get us familiar with using WooClap as a platform, this is a word cloud exercise. Just answer the question, what drew you to this session today? Why are you here? Love it. I love a word cloud. Hopefully people online are able to access the link as well. Love it. Okay. So we got a lot of future catharsis, what's coming, remembering, hearing, curious about global impact. Okay, so I'm seeing a lot of reflection and listening and forward thinking, which I think is a really great perspective to bring into this event. Great, thanks everyone. That will come back, WooClap, so maybe just keep it open on your phone. Okay, so my name's Nikki Banky. I forgot to introduce myself. That's a pretty crucial thing to do at the beginning of a side event. But my name's Nikki Banky. I was a water and sanitation advisor at USAID. I was at USAID for about 4.5 years. I was at the Water Institute before that as a staff member. I'm now back as a staff member, which has been great. My main focus was on mostly the Middle East and Senegal, and then also humanitarian development, peace coherence. Those are sort of my technical areas. I was on the technical services team, which is part of the reason that I took the technical session, I guess. So yeah, it was a really great 4.5 years at USAID. Obviously very sad that it ended the way it did. But I'm excited to have this conversation with you all today. And so also I wanted to quickly introduce, since they will be leading other sessions this week, this is Lisa Scheckman, and then Zach Burt, both colleagues from the water team at USAID. And then online we have Katie McElhinney, who's also on the water team, and she's going to be the online moderator, and she's going to manage the online engagement, and she'll also be here in person on Wednesday. And she just said, hi, good morning in the chat, which I can see, but you guys can't see. Okay. So, this is our roadmap of the week. As I mentioned, this is one of 4 sessions. Today, we're going to focus on technical approaches. Then tomorrow morning, we have blueprints for a better bureaucracy, which is going to focus on the structure of USAID and the program cycle, the 5-year fundings, all of that. The sound from the room is a bit low. Okay, I'll talk a little bit more into the microphone. Sorry, I'm seeing some stuff that you aren't seeing. Curse of the moderator. And so Zach will be leading that one tomorrow, same room, same time. Then the lunch session tomorrow will be led by Lisa, which is going to focus on the global water strategy and USAID's global impact from like an influence perspective. And then on Wednesday morning, same time, same place, Katie will lead us through our learning and research strategy and kind of some lessons learned that we can carry forward. Yeah, same timing, this room. I'm looking at my notes. So the series objective, I think I mentioned this a little bit up top, but really Zach was really the person who came up with this, and he reached out to us and basically said, you know, there's going to be a pretty noticeable gap at Water and Health this year. Is there an opportunity for us to kind of reflect on USAID's legacy? And so we came up with this series, and really the output at the end, and you can see this as the first objective, is to document the findings from this week, to put it into a white paper or some kind of paper, maybe in a journal or otherwise, that sort of lays a blueprint for if at some point the U.S. decides, hopefully when, the U.S. decides to invest in WASH again, what are some things that those people should know, the decision makers. We also want to capture institutional knowledge and think about what could the future look like. And one of the great things about this conference is that it brings together a lot of the best minds in WASH, and I think that that is a great opportunity that we wanted to seize upon for this paper. Just a few housekeeping items. As I mentioned, online participants will be actively engaged. When we do breakout groups, they will be in their own breakout group facilitated by Katie. And then we're going to do, at least for the paper, because this is all recorded and live streamed, so it's Chatham House rules doesn't really apply in that sense, but in terms of the paper, we're not going to attribute anything. We might use quotes or insights that come up, but we won't directly quote you and list your name. The third one, be honest and direct with your reflections. That is my veiled way of saying don't be afraid to hurt our feelings. We are not with USAID anymore. We want to hear kind of what your thoughts are. We want the honest opinions. If you think something didn't work, we want to hear that. And then, yeah, so also wanted to note, this session is mostly focused on the technical aspects, and other, you know, the structure and the strategy and the knowledge and learning components will come into play, but try to focus on the technical approach for today, since we'll have time for those discussions later. And then think beyond the box. It's a little more than think outside the box, because the box has been blown up. There is no box, so I want to encourage people to really just think, what if you didn't have the restrictions that did exist? What if there was no global water strategy? There kind of isn't. What if there wasn't, you know, earmarks or restrictions or whatever it is? So kind of allow yourself to imagine think a little bit bigger. What to expect from today? So I've given the introduction, and I'm going to give a quick level-setting conversation just to kind of look back on how USAID WASH worked. Then we're going to do breakout group discussions, and we're going to do 3 rounds to discuss these different discussion questions around what worked, what didn't, and what did we miss, what opportunities did we miss. And then we will have our facilitators report out just very quickly, so that we've gotten the juices flowing, sort of capture a few top line thoughts, and then we'll go into a group discussion and sort of prioritize these different ideas that come up. Okay, so reminder that the box has been blown up. Now I'm going to remind you what the box did look like. I mean, this metaphor is really a stretch now, but it's fine. Okay, Any questions before I launch into this little history lesson? Okay, cool. So, Water Directive. This is what was sort of the funding backbone of all of the work on WASH that USAID did. It really goes back to 2005 and 2014 when the Water for the Poor and Water for the World Act were passed. Water for the World Act was passed unanimously in Congress, and it authorized the use of taxpayer dollars for water and sanitation programs abroad. And this earmark or directive increased steadily over the past several years. It did go down a little bit. In the last year it was about 450, not 475, but its peak was 475. So in terms of the development side of WASH, we were investing about $500 million a year of taxpayer money into water and sanitation programs. On top of that, there's also humanitarian response WASH, so life-saving aid in response to emergencies. That was more than another $500 million or so. So really altogether about $1 billion a year being invested. And something that's important to note is that 95% of that or more was programmed through our bilateral missions, which are the field offices that are based usually at embassies abroad. And so we only managed in DC about 4% of that budget. And we tried to leverage it to sort of catalyze research, learning, whatever made sense in terms of strategic influence. So yeah, that's an important thing about structure that's important to remember. Also, the Water for the World Act was very pro-poor. It was very focused on WASH, water and sanitation and hygiene. It was meant to really tackle issues that affected the poorest populations, which is an important thing for how we framed a lot of our programs. Where we worked, so this is kind of a blurry map that I created on Google Sheets. It's based on the past couple of years. The dark blue is our high priority countries. The light blue is countries where we were investing. I think I cut it off at more than $1 million on WASH in FY24, at least based on the budget numbers. We selected countries as high priority countries based on a combination of opportunity and need, and that was redesignated every year. There were 22 of them, most of which were in sub-Saharan Africa by the time everything happened. And then something that's important to mention as well, even though it's in light blue and they're very small countries relatively speaking, we invested a lot of the $500 million in the Middle East, in Jordan, Lebanon, and West Bank, Gaza, which were designated as strategic priority countries. So we brought in the kind of geopolitical strategic impact as well as the need and opportunity. Something that came out of the Water for the World Act was the requirement to write a global water strategy, which was to be led by USAID and the State Department. And so we had our first global water strategy in 2017 and then revised it in 2022. So I'm going to go into what the strategic objectives of that strategy were, and that's the 2022 version. So these were the four sort of pillars of the global water strategy. The first focused on governance and finance and markets. The second was focused on access to safe, sustainable, and climate-resilient drinking water and sanitation and hygiene. The third was focused on water resources management, so thinking about water beyond just WASH. And then the fourth, which was an entirely new objective, was focused on anticipating and reducing fragility and conflict related to water. These were the targets that we had set for this 5-year global water strategy period, and we were well on our way to reaching all of those targets, especially the institutions one. I think we might have already passed that one 2.5 years into the strategy period. And something important to note is at the bottom it says half of each target will reflect people who have never before had access to a basic level of service. So there's that kind of pro-poor equity lens that shows how it went through all of our work. Before we talk about potential pivots, pivot is maybe a nice term for how we're going to do this, but before we go into the future, I wanted to sort of talk about how USAID did respond to changing evidence and pivot our programming. So one thing I wanted to flag is, based on evidence around low rates of sustainability of things like rural boreholes and hand pumps, we really shifted our approach from not just being, okay, let's install as many taps and toilets as possible and water points, to system strengthening. How can we catalyze impact? How can we be strategic with the seemingly large but very limited amount of funding that we have to invest in this every year? How can we bolster governments and bolster systems and build in resilience? There was also a pretty significant shift from just focusing on WASH kind of as a health issue primarily, to thinking about water security more broadly, and water for all of its uses, water for ecosystems, water for agriculture, water for industry. There's obviously there was a growing impact that this fluctuated with administrations. There was a growing emphasis on climate resilience, especially in the 2020 to 2024 period. A growing emphasis on trying to avoid the silos of just development WASH and humanitarian WASH, and thinking, okay, now that a lot of places are increasingly going to kind of dip in and out of emergency stages, whether that's because of natural disasters or conflict, those are increasing. So we need to think about how to promote humanitarian development, peace, coherence in our work. That was evidenced by the addition of Strategic Objective 4. Localization was something that was kind of growing as a buzzword, especially in the past few years, but it really reflected a commitment to trying to directly fund and empower our local partners directly, more and more of our funding, rather than going through larger international organizations. And then something that we had to do regularly was navigate shifting political priorities. If there was a presidential or congressional priority that popped up, we needed to pivot in response to that. So we were no stranger to pivoting, I think, is the main point here. Okay, so we're going to go into breakout groups. There's going to be 3 of them. And the 3 things that we're going to talk about, one group that's going to be with Lisa is going to talk about what was USAID doing well? What was our comparative advantage? What should we have kept doing if things were to continue? Everyone's going to talk about all 3, by the way. Then Zach is going to lead the one that is focused on where did USAID fail and how could the technical approach have been improved. What wasn't working? Were we investing in something that you think was ineffective? This is a good place to talk about that. And then I'm going to lead a breakout group that's focused on what areas should we have prioritized more that we hadn't prioritized. So what opportunities did we miss? What should we have capitalized upon? The fact that tech support is here is maybe an issue.
Sorry, the virtual audience is saying the audio is low.
Oh, okay.
Yeah, so just tweak a couple settings here.
Thank you.
Not a problem. Let's, test 1, 2. Cool. That should be good.
Okay. Thank you.
All right. You're welcome.
Appreciate it. Okay, so each group will discuss one question and then rotate, so you'll get to talk about all 3. They just won't be in the same order depending on which group you go to first. And if you are kind of feeling stuck in terms of what you want to talk about with this, think about these sort of topics that I've listed at the bottom. Think about the geographic focus. Are there countries that we didn't work in that we should have worked in? Are there countries we worked in that you don't think were a great use of investment? Demographic focus, rural versus urban versus peri-urban. Should we have focused more on women and girls? Should we have focused on persons with disabilities more? Like, think about the populations we were trying to serve. Technical areas, so kind of in the subsectors, so like WASH and healthcare facilities, or menstrual health and hygiene, things like that. Or like, should we have prioritized sanitation more than we did rather than water? So there's a few different questions there. Model and approach. if you want to debate market-based sanitation, CLTS versus other different models and approaches, this is a place to do that. Type of award, so this is getting a little nitty-gritty, but if you were an implementing partner, did you prefer contracts versus cooperative agreements? I know this is super wonky language, but this is how foreign assistance is structured or was structured, so it's helpful to know. And then cross-cutting themes like gender and climate. How did we address those? Should we have done it in a different way or more? So I'm gonna break us into groups. I think I'll just kind of do it by location. So maybe that sort of group can go over there. That back area can go to the left, and then maybe the first couple of rows can come here. I'll put Zach over there, Lisa there, and I'll be here. And we'll have 15 minutes in each group, and then rotate 3 times, and then we'll come back together and have a group discussion. Katie, I'm gonna mute the room.
Sounds good, Nikki.
Hang on. Yeah. Sorry, Katie, can you talk if you can hear me?
Yes, can you hear me?
Yes, I'm gonna mute you guys and then mute.
Great, welcome everyone. Can I just ask, wanting to make sure that people can see and hear me as I hope to facilitate this discussion for those of you that have joined us virtually. So can you just go ahead and leave a comment in the chat to see if you can hear me? Okay, great. Thank you. Thank you. Perfect. Perfect. Well, welcome everyone. I think Nikki did a great job to frame like this conversation, just to kind of highlight who I am and what my role is here. My name is Katie McElhaney. I was a colleague of Nikki's at USAID on the WASH team. My role was the senior learning advisor, and I was on the policy and learning side. So did a lot of work with data, learning, and kind of thinking about strengthening capacity within our missions and within our partners. So I am here to help facilitate this discussion online. And with that, what I have done is actually, I cannot screen share. Well, I thought then, wondering if I can. Okay. I
Catherine,
am
can you
not.
hear me?
Oh, sorry. Yes, I can hear you.
Yes, so you should be able to screen share. However, you would need to end the current presentation that we have from the room. Yes, but you are able to screen share.
Should I end it?
If this is not going to be used the rest of the session, the slide that we see right now, yes.
I think Nikki is going to come back to these slides. Sorry, I'm just like thinking about how to adaptively manage here. And I'm sure, I feel like she probably needs these displayed in the room for the conversation.
You can end this because they won't end for the in-person people, so it would just be on the virtual side.
Oh, okay.
If we need that other one back up, we just liaise with the Friday Center to put it back on after you finish.
Oh, wonderful. Okay, so then how do I end?
You would have to click on the green arrow that is facing upwards on the center of the Zoom that says share. Then you select what you want to share, and you will have the option to replace the current slide that is being shared.
Okay, so yeah, I'm on the share screen, but it just says disabled share. You cannot share, start screen share while the other participant is sharing.
Got it. Let me see if I can do something here.
Yep. Thank you. I'm sorry. Oh, perfect.
Yeah, you should be able to screen share now.
Great, great, wonderful. Thank you. Okay, so yeah, I thought that what I could do is actually we could work kind of in the slide deck that Nikki created, but collect your input from through this kind of conversation. So we'll go through all 3 questions over the course of the next roughly 45 minutes, and thought we would start with what did USAID do well? So would love to maybe if people can kind of come off mute or raise your hand, then we can invite some discussion. But with this first conversation, would love to hear, in your opinion, what was the most effective kind of USAID project you worked on or observed, and what made it effective, so that we can kind of maybe think about that in like that kind of framing. And I'll capture people's thoughts, whether you want to raise your hand and come off mute, or even go ahead and use the chat function to share. So I'll give you some time to kind of think about this. So I see a hand raised. Do you want to come off mute? Just checking in with like technical support. Do people have the opportunity to come off mute? Okay, wonderful. Thank you. Great. Thank you, Nicole. Long established relationships with host countries. I hope everyone can see my screen. Can I just get like maybe a thumbs up or a reaction that you're able to see my screen? Wonderful. Capacity building. Great. So you can see how I'm using this function to help kind of capture your thoughts live. Now they're coming in. Thank you so much, everyone. The focus on sustainability. Meeting the needs and gaps. I'd love to hear what you were, if I could ask for a little bit more context, Saeed, meeting the needs and gaps of the WASH sector. Would love to hear what you were thinking in terms of that. Perfect, great. Working with cross-sector, great. I'm capturing all of these. So wonderful, everyone. Thank you so much. So Janet, for BHA, the ability to rapidly respond and fund humanitarian aid. Yes, and Nikki kind of highlighted that as that was definitely something that we were pivoting to. Piloting new initiatives such as market-based sanitation. Excellent. Provision of health services, financial support. And Saeed, again, would love to hear a little bit more about the integration agenda. So what was it specifically that you were kind of like thinking about? I want to capture that a little bit. Support R&D on market-based sanitation. So again, that kind of complements, some piloting initiatives, but really understanding how that kind of supports. So I'm going to just kind of group those a little bit together here. Okay, USAID did a solid job of maintaining technical quality, thanks to a strong team of WASH advisors who made sure implementers stayed on track and didn't cut corners. Wonderful. Not a lot of big institutional donors manage to do this, and it usually ends up being a matter of how well the implementer cares about quality. Really great insights, everyone. Thank you so much for coming to this session. Investment in rigorous learning questions to do WASH better. Yes. Health system strengthening. Is that more related, Saeed, just to in terms of like the integration agenda? Is that like kind of an elaborate, like just to kind of build upon that? WASH and health facilities and integration agenda. Excellent. Great. And then social behavior change and communication. I'm assuming that's what the SBCC stands for. Hopefully I captured that. Are there any other things that you feel like that are really standing out on, in your opinion? Maybe we really captured some technical areas or context. So a lot of talk about market-based sanitation and healthcare facilities. Are there other kind of more unique or specific technical areas where you feel like, in your opinion, that was most effective for USAID? Climate, extreme weather, and environmental stress responses. Great. Finance. I know it's so much to type. I'm sorry, everyone. I was really hoping that we could have a discussion and it wouldn't just be all me talking at you. Trying to do my best here, but hope that this is helpful and just kind of like generating some additional thoughts that you might have. Great, Peter, thank you. Evidence generation and knowledge sharing. I'd love to hear if there's any specific examples that are coming to mind, like if any of you that are online had experience with some of our programs, would love to hear if there's something specific that I can attribute some of these insights to. Great, Mohammed. I love that. The CLA approach. So how we integrated collaborating, learning, and adapting into our work, and how it worked nicely for knowledge management products. We had, the technical white papers that were readily available on global waters. So I think that that is a very important thing to highlight. Village health leaders, training and ensuring community ownership at community level. Yes, that's a great example and something that I think that Nikki was talking about, how we were kind of really thinking about localization and strengthening capacity in local partners. Oh, really great insight here. USAID's funding was relatively stable and predictable, which made it possible to plan long term. For example, RFSAs, that kind of reliability is essential for achieving genuine water security in meaningful system strengthening. Thank you so much. And thank you for thinking of and highlighting some really prioritizing gender equality and social inclusion. Great. Zimbabwe, working towards WASH and nutrition integration and local capacity development. Thank you, Saeed, for a really good concrete example here of some programs. Water point maintenance, WASH COM training, and capacity building. Amalima, is that correct? Was it spelled wrong there, Saeed? Oh. Okay, great. Just picking up here. I know it's so hard to type. Thank you. Great, Mohammed. I love this. The risk communication and community engagement, well tried on the onset of COVID-19. Yes, this team was very busy during that time and really created some of the first responses on how to support COVID-19 and manage that. So that's an excellent example of something to highlight. Really working across sectors. Great example from Malawi on food resilience and working towards WASH and nutrition integration apart from agricultural productivity. Linked to integration. Great. Irrigation, sorry, not integration. Improving local water quality labs and the fund had support system from local communities so that drinking water could be regularly tested and other health related parameters. Great, Derek. Is there, did you want to maybe even highlight that program if it's possible, if you feel comfortable? Well, maybe Derek, you're doing that. I am noticing in the room that it does seem like the groups are shifting, which might be a good cue for us to move from what worked well to the other side of the coin, right? So hearing from you, where could USAID have improved? I hate using the word fail. But would love to take some time to really kind of document what USAID approaches or projects did you work on or observe that were least effective? So things that you noticed that were not working. So allow everyone a little bit of time to process that. Okay, great, Janet. So perhaps sanitation programming in humanitarian relief contexts. Um, Maybe Janet, if you have a chance to kind of articulate any specifics that maybe come to mind, that might be helpful, especially when we're kind of processing these findings. I don't know if you heard at the top of the hour, if you might have joined late, but Nikki really highlighted where all of like the series, this entire post-mortem series that we're hosting this week, we're hoping to provide additional kind of context through a white paper, an opinion piece that Zach will be kind of taking on. So additional kind of context would be really helpful. So should focus on HSS support, DRM integration at policy advocacy service delivery level. Great. So just thinking about perhaps, again, you know, maybe what USAID approaches or projects did you work on or observe that were the least effective? What strategic mistakes do you think USAID made in its technical approach? So these are just kind of like some additional kind of questions to help think about, should focus on, okay, great. Thank you, Zalim. So focusing a little bit more on marginalized communities and population segments. Other areas where you feel we could have strengthened our technical. Climate change and WASH, yes, yes. Climate change and WASH. Greater support and investment in novel community-based behavior change programs beyond CLTS. And I do want to highlight that our colleague Na is also on the call, and I believe she's kind of providing additional kind of context here in the chat. And she was part of the extended WASH team. So thank you, Na. CLTS was sometimes promoted. However, it's not a great model for transient IDPs. Great. Where community structures are not consistent. Excellent, Zachary. Yes, the 5-year funding cycle sometimes hampered the ability to have continuity and long-term relationships with local stakeholders. You're absolutely right. Um, Zach's session tomorrow morning at this same time is going to be getting into a little bit of that. So if you want to join and kind of like weigh in on that, but I'm gonna highlight that again here because I think that that is probably something that will kind of continue to surface. Gender responsive program design needed to be scaled up broadly. You're great, Mohammed. Saeed, you're just noticing BHA did lots of activities on climate change and WASH. So just kind of maybe adding that as like a subnote, wow, we could have done better, just still acknowledging that there was something there. So thank you for that kind of contrast or building on. Oh, I like this. Equal emphasis on hardware and software component. So far, hardware part is neglected, assuming government could cover, which is not implemented, given the country's economic condition. And you're just adding some really great bullets here. So gender equity, social inclusion, full WASH package at healthcare facilities, mainstreaming WASH and national healthcare system. Great. So I'm going to add that here. Nicole, really good insight. The ownership of WASH programs were not easily transferred to host countries, even though they were responsible for their sustainability. So while efforts were to really kind of focus and strengthen that, that kind of transfer of ownership might have been weak. Yeah. Water treatment activities needed to be climate resilient and salinity proof in South regions like Bangladesh and other low income countries. Really excellent insights and contributions, everyone. Thank you so much. I know it's a lot to type your thoughts, so I really appreciate it. Funding labeled as emergency was structured and rigid and felt little room to adapt or make strategic change, even when field realities clearly showed that adjustments were needed. Great. Clear criteria to select the implementation unit better to be set. Great. So improve kind of communication with our partners on how to select that criteria or what criteria we're looking for. Excellent. Peter, this is excellent. So there was potential streamlining prior approval processes. Yes, definitely kind of goes hand in hand with like the 5-year kind of contracting experience delays and getting prior approvals, especially for hardware components in cases where USAID substantial involvement was required. So a lot of processes and paperwork to kind of go through. impact evaluation by independent body in addition to the M&E period. So maybe if you have additional insight on that, that would be helpful for just even more clarity or kind of context there. Periodic M&E, okay. So maybe the M&E is not as consistent as what it should have been. And having like that additional oversight would have been helpful, it sounds like. Okay, scale up of best practices within or across countries. So making like kind of like those connections within, so working within countries and across them, but then also thinking about like the regional impact that we might have been having. Generating most significant change stories internally would be more effective in regular manner rather than at the end of the project or closeout. I love that insight, Mohammed, and really thinking about how we could have done a better job of telling our story and what kind of impact we were having. Research and development by experienced researchers and institutions. So perhaps more of that. Maybe I'll just give like a few more, like one more minute or so for any kind of final thoughts on what USA could have done to adapt, and how could the techno approach have been approved. Yeah, sorry, had been improved. Sorry, everyone. Peter, there was a potential streamlining prior approval processes, experience delays in getting prior approvals, especially for hardware component. Oh, sorry, that's an old one. So Zachary, really seconding Mohammed's comment above, not a specific USAID critique, but more of the entire WASH donor community on communicating the importance of supporting WASH around the world. Yes. I love that. And I'm going to put that as a linked kind of comment here. Great. Attention to recruitment and selection must be fair based on skills, knowledge, and experience. Great, everyone. I really appreciate all of these wonderful insights based off of your experience working with USAID. Um, looking at time, I think it looks like the groups are going to transition here momentarily. So I'd like to move on. Ooh, so some additional kind of insights here. Digital health and WASH, AI and WASH. So yeah, I think we were just getting into how we could really build upon and expand our work in those areas um, before things started to kind of slow down. Well, deteriorate, I guess. So we were really just getting into setting kind of like those standards and supporting kind of pilots for how we could leverage AI in particular in this sector. But I'm going to document that it really got cut short. So maybe I'd like to transition us to the last kind of question here. One Health approach. Oh, very great. So something similar to the One Health approach. Yeah, that was a great program. I'd like to transition us now to the last kind of question that that Nikki has invited us to kind of unpack. And love to hear like what technical areas should USAID have prioritized more? What strategic opportunities were we missing? And I think Nikki did an excellent job of kind of framing the role that the global water strategy had and supporting our technical areas that we focused on. But would love to take this time to really hear from all of you of where you feel as experts yourself, the WASH sector should expand, and what kind of priorities should we be kind of considering? So again, would love to hear from you. Is there anything specific that you feel like the technical areas USAID should have prioritized more? What strategic opportunities were we missing? Thank you, Angela, for getting us started. So you are newly learning and getting involved, but you've been in higher education for 10 years. So really visibility is what you're thinking. So visibility of the impact that we are having across the WASH sector. Is that what you were kind of thinking? Perfect. Sustainability of WASH programs. So really thinking just beyond like the 5 years and looking at some of like those kind of impact and that story that we were trying to tell. I love that, Nicole. Thank you. Oops. I'm just kind of like looking back here at some of the things that we kind of highlighted on even what we did well. And just to kind of recap, if that kind of jogs people's thoughts about what other areas we should have been focused on, okay. Oh, that's great. Having events at the community college area. So that's really great. Thinking that's a really great idea, Angela. So thinking about like not only and maybe not even only kind of events in the US, but maybe how we could have partnered in our host countries with universities and colleges. So hosting events like that, like this in other kind of countries. I think a long message came in. Okay, climate resilience and WASH. WASH health systems, integration beyond institutions, behavior change, innovation and digital transformation, urban WASH and informal settlements, One Health and WASH linkages, financing and domestic resource mobilization. These are excellent insights. Thank you so much. Each one of these could be their own stickies, so maybe I'll do that. It's always hard typing in front of a group. You always notice maybe there might be better ways of doing this, but thank you everyone for being patient with me as I'm documenting your thoughts so that we have this to kind of process through these entire series. Securing greater political support for domestic investments in WASH within host countries. Yes. really kind of seeing the linkages between what US private sector, maybe companies were doing, and how we can kind of make bigger impact. Advocacy, advocacy, advocacy. Yes. Thank you, Salim. I think that that is so important. Oh, nurturing our high profile partnerships that both increased impact and communications and awareness. We live in a social media driven world, for better or worse. Yep. Mr. Beast's recent wash campaign generated a lot of publicity, although I have no idea how sustainable his work is. Zachary, that is such a great insight. I remember one day we were actually talking about that as a team that went through one of our chat group threads, was how easy he made it look, some of like the wash work that he did, and how inspiring it was, but then questioning the sustainability of it. But it did look like, there was a lot of like local investment. But that's great insight. So how we could have done more with that work. And as a parent of a 10-year-old, Mr. Beast it's amazing, kind of like the I guess the influence that he has, particularly to the next generation. And so how, little kind of stories like that could lead to the next wash kind of generation that comes up. Wash and SDGs. So maybe just kind of wash and SDGs. So maybe making better connections to wash and how our targets were making an impact to SDGs, I'm assuming, and then wash and urbanization. Great. Pushing partner governments and implementers towards more results-focused funding arrangements, particularly in rural areas where it's been hard to come up with alternatives to things like community committees to manage hand pumps, which hasn't been working too well. Great. Great. More so, I know we were just getting ready to talk a little bit more about some research and evidence that we had, that one of our partners had been working on and was ready to talk about in terms of preventing outbreaks like cholera. So missing that kind of opportunity there. Ensure every country's government wash services, social accountability for better outcome. Great. So Nikki just sent me a prompt that we are kind of, that the small groups are kind of wrapping up in the room. So I just wanted to really take a moment to thank you all so much for these amazing contributions. I'm so sorry that this has been more me kind of talking at you and kind of reading your insights. I was hoping to have a little bit more of a discussion and a dialogue, but wanted to thank you all so much for these contributions. And just reiterate how we're going to use this series, this post-mortem series on USAID throughout the week, to hopefully document some lessons learned, and capture some of the knowledge that we were able to kind of cultivate with our partners, with all of you, and hopefully put out a white paper that kind of talks more about what's in store for the sector with the loss of USAID, and where we might need academia, where we might need the private sector, where we might need nonprofits and creative solutions to kind of step in and kind of fill those gaps. So hopefully you can jump in throughout like this series, and yeah, would love to see you both either online or maybe in person if you have a chance to come throughout the week. So thank you so much, everyone. And I'm going to get your kind of insight there, Mohammed, here. I want to make sure. I'm just going to go, I'm going to stop sharing my screen. And I'm going to go on mute and off video so I can kind of maybe quickly process some of our insights. So thank you, everyone.
Hi folks online, if you could be wrapping up and come back into, I guess you don't have to come back, but no, be wrapping up, thank you.
There will be more opportunities with that to have or think of leader. Not everybody can come.
Yeah, so
Thank you guys.
it's replenishment.
Okay, we're doing blue clap again for the last few minutes. Oh yeah, I didn't, well, okay, we'll put the chairs back after. Katie, can you hear me now?
I can hear you, Nikki.
Great, thank you.
10-year investments to effectively replenish.
Okie dokie. So for folks online and in the room, if you could pull blue clap back up again, we only have 5 minutes. We actually went longer on the breakout sometimes, which is great. It means we all had great discussions. I'll just give 1 second. Great, it should still be in your browser, but just in case. Okay. So basically what we're going to do here is, that was meant to get the juices flowing, and I know we're about to be at the end, so the juices are definitely flowing. But if you could, based on the conversations you had, kind of input into these different areas. We have the ones I mentioned: technical areas, geographic focus, demographic focus, model approach, type of award, and I don't remember what the last one is. Cross-cutting themes. Just like some thoughts that arose for you in the conversation. And one cool thing is, once you put them in, you can like people's responses, and that's helpful for prioritizing which ones make the most sense.
And on your phone, if you want to choose a different, there's like a drop-down menu above the box that you type it in if you want to choose a different category to put your thoughts into.
So it's a little weird to be in a very interactive side event and we're all staring at our phones, but it is helpful.
Are there virtual people back in?
Yeah.
Remember.
Nikki, this is Katie. Sorry, Nikki. Nikki?
Interesting.
Hello?
I'll just give us a couple of minutes to do this. Oh, wow. Lots in technical areas. Love it. Oh, Katie can't see my screen. That's a bit strange.
I can see the room, but I can't see your screen. It's because I was presenting, Nikki.
Do I just need to do that? We have to bring it over. This is... Okay, well, that's okay. Oh, there it is. Share screen. Cool, thank you. Oops. Yep, I think we're Great, this is super helpful. I don't think it'll let us keep putting feedback in after I move the slide, but just to kind of get the data a little bit so that it's easier for us to refer to in addition to the notes. And yeah, so before we wrap, oh, I meant to do that for all three, but that was definitely ambitious with 3 breakout groups. So thank you everyone for joining and for a really great productive conversation. It's been really nice to talk through all of these things with you, and in spite of everything that's happened this year, to try and move forward. And yeah, I think that's probably going to be it for today. Thank you so much. And if you could, another QR code. This is another way for us to kind of complement our notes and data. If you could scan this QR code and then take the survey. That way, if you have thoughts that you want to bring back later, that would be really helpful just to kind of complement everything else that we have. And that's it.
And,
Yeah, oh, yes.
and this QR code is gonna take you to a survey that's gonna be the same survey available
Yes.
at each of our 4 sessions.
So if you want to fill it out at the end and just spend a long time on it, you could do that. Or I guess you could fill it out
Yeah.
4 times.
Or attend all 4 sessions and then put your final cumulative thoughts into
Yeah.
this survey. It will be available.
Yeah.
And it's open-ended questions about the topics of all 4 sessions. So feel free to use it when and how you want.
Great. Oh, hi. Was that a hi or a raised hand?
So, you're going to repeat the whole thing in the next few minutes?
Yeah. Yeah.
Sorry.
Way to roll in, John.
When I just rolled in. And the 2 advocacy sessions that relate to
Yes.
some of this at lunchtime on Wednesday and Thursday.
Yeah. Okay, if everyone could put your chairs back before you go out to get coffee, that would be fantastic. We do get charged if the rooms are too disheveled. Thank you, everyone. Thank you online, and thank you, Katie.
I give that
Hi, John.
A+.
If you need help on the list or writing, feel free to
Thank you, I appreciate it.
But I got Gilbert really good.
All good. I just wanted an email address for where the notes should be.
Oh, Banky@unc.edu.
I see this one.
Yes.
CEHN
Yeah.
at unc.edu.
Yes, and I should.